Hey guys, all right, we're gonna do some hip flexibility. So we're gonna work on our hip flexors. So a little bit about the hip flexors. We have your main hip flexor, which is your iliopsoas. Not a lot of people know about this muscle because it actually starts in your back. So it starts from your last four transverse processes, so the side prongs of your vertebrae. There's one in the middle, the spinous process, and then there was two that go out the side. Those are the transverse processes. So your iliopsoas actually connects on the sides of those, goes through your hip, and then attaches on your inside of your leg. And then we have your sartorius muscle. So that's going to attach on your iliac crest. So it's your anterior superior iliac spine. And then, so that's that little, the little bump right here that you feel in the corner. And then there's the rectus femoris, that's part of your quad, and that's going to attach on your ASIS, your anterior, or your AIIS, anterior inferior iliac spine. So that's just the bump right in line with the ASIS, just right below, okay? So you want to make sure to trigger all these muscles, and especially in the back too, because that tightness you're getting from those hip flexors could be coming from your iliopsoas, and that's really hard to get to. So we're going to use our massage block today. I'm going to teach you guys how to do a little bit of release for that. So first, the iliopsoas, I want you to come here. It's right in this spot here. You're going to take the massage block and you're going to lay on it. So you're going to come right here. Lacrosse ball massage block, go ahead. I like the massage blocks because they have more of a trigger point on them, so it helps a lot better. So you just find that area there and you're going to lay right on top of it. Okay? One thing that really helps me is I bring my leg up and then I rotate it out to the side. And you can bounce it. But you can only do this if you're completely relaxed. So if you feel like it hurts too much to where you can't relax, don't move your leg. Just keep it steady. And just let it trigger right in there. Then again, it's the last four vertebrae. So you really want to work the entire lower back area. Get as close as you can to your sacrum. And just try to completely relax. So I hold it for about 10 seconds in each spot, lower it inch by inch. Again, I would really like to bend my leg out like this. It really triggers that hip flexor. Just let it rest on there. And then you're going to come to do your front of your leg. So first, come right in where your hip is. Okay, you're going to take the block and lay directly on it. You're going to lay directly on there. Okay, so we're going to start from the most proximal, so the closest to the trunk. And you're going to lay them right on top of it and just let it dead weight. Okay, so if you can't relax, don't move your leg. But if you can relax, you can go ahead and bend your quad. So that's going to get some active release going in there. You can external and internal rotate too if you'd like. Just make sure that you can completely relax. If you can't completely relax, then you're gonna muscle guard, and then you won't be able to penetrate deeper into the tissues. So I'd hold it for about 10-15 seconds. If it's a problem that's chronic and that really bothers you all the time, you can sit here for like 5 minutes if you want. So if you have an issue, I tell everyone, if you have something, fix it. Don't sit there and just half-ass it. Actually get to the problem and fix it, okay? So if it's a bad problem, then stay on there a little bit longer. And then little by little, inch it down, okay? Your sartorius goes all over the place, so you can mainly trigger it from up here. But your rectus femoris, I want you to go all the way down your entire quad, okay? So you start at the top, and then inch by inch, stay directly in the middle of that quad, because you have four parts of your quad, obviously, quad. So you don't want to get off that rectus femoris, okay? Because the rectus femoris is the only one that does hip flexion. The other ones don't cross at the hip, so they don't do hip flexion. And again, if you can relax, just completely relax. You can move your leg, get some active release, but don't flex that quad. Try to just let your leg be passive. You can even grab, a string or a belt and pull your leg up with your arm if you want. If you can't completely relax, inch by inch it down. Okay, again, a little bit lower. feel a tender spot, stay on that area and really work that spot. So if you want to sit there for like a minute, let it relax. And then when you feel like you can move your leg, then go ahead and bounce through it. I try to go through the full range of motion. It hurts. And then come down. So if you find a tender spot, that just means that your muscle needs recovery in that area. So you want to actually stay there and work it. Even though it does hurt, it's because you're basically neglecting it. Okay, so come all the way down. And I want you to go all the way down until you reach your patella. Alright? So, again, this is our massage block. Doing some hip recovery. Do it right, don't do it at all. Keep your body healthy, keep your range of motion, keep your joints healthy. Alright, thanks guys. I'll talk to you later.